Rogers Behavioral Health this
Welcome to Rogers San Diego. Come on in and I'll show you around. My name is Nader Amir and I'm the clinical director here at San Diego. Rogers is here because there's a great need in San Diego for a little bit higher level of care than once a week, and these are for folks that need more intensive treatment for OCD or depression. Show you some of the rooms we have, lockers for patients, individual rooms for all the patients.
We are very good at what we do. All of our staff is very well trained. Our leadership has years and years of experience in these fields, and we are here to help and to pass on that knowledge.
So this is a waiting room for the parents that parents use while they're waiting for their children in the program.
So we can bring the family in and in a safe, supportive, and non-judgmental way, give them actual concrete tools to use each morning, each night, over the weekends, so that the whole family is working together. And ultimately, treatment is temporary. We need people to be able to go back to home environments, to work environments, to school environments, where they're being supported in an evidence-based and really practical way.
Everybody says we're evidence-based, and Rogers is pretty much the only program I know, or the only hospital I know, that has that data listed on their website. So you can actually go there and see that the patients that come here get better after being at Rogers. Whereas other programs that tell you they're evidence-based, you say, well, can you show me that this is actually working? They have no data to back it up.
Good morning.
This is a team approach, and they all work together to help the patients. And we have very regular meetings where we discuss each patient and try to make sure that we have a consensus agreement as to what's the best approach for that patient. And the patients oftentimes kind of attend those meetings, so we all sit together and discuss it with the patient there. Psychiatrist offices, psychologist offices, as well as the nurse's office over here.
There are other intensive outpatient therapy programs out there. They usually don't have any psychiatrists. They also usually don't have a nursing staff, and we have a nurse full-time. So we're able to handle a broader range of the different problems in a more comprehensive way.
And our shower that we're very proud of, and the shower is for patients to exercise various kind of washing activities that they might have difficulties doing.
We try not to get too kind of lost in the details and really focusing on, okay, let's target this, okay, let's target this. We try to kind of step back and look at the big picture and think about, wait a second, this person that is in front of us now looks so different than the person who came to us 4 weeks ago or 6 weeks ago. That is just such a joy to be able to see that unfold.
So we're looking at the child and adolescent side, which is kind of a mirror image of what we had on the adult side. Again, all the kids have their rooms and their lockers. These are some of the therapists. You can actually get a bunch of them sitting in there.
We don't think that people are just a diagnosis and here's the treatment plan. It's like, let's create a treatment plan and interventions that match who you are, your values and what's going on for you as a person, not as, okay, you and you're this diagnosis. So I love that about Rogers.
This is where the kids do some of their school activities with Michael.
I think they leave here feeling very equipped to handle things that they came in saying, there's no way that I'm going to do that. This is for their life. These are things that they're going to use forever.
Recovery is more than just checking some boxes on a survey. It's about finding joy and peace and fulfillment in what we do every day. Being able to have families tell us, I'm laughing with my child again, or my husband and I went on a date for the first time in 6 months. Well, that's really where we see success. That's really where we see our patients thrive when they leave here, is those little moments that they can connect with their families, those small changes that make such a huge difference in the day-to-day lives of the people that come to Rogers.